Hello viewers, good morning, good afternoon, good evening, depending on where you are watching us from. Welcome to my EMTCT channel. EMTCT is Elimination of Mother to Child HIV Transmission. So I am back, and today I want to talk about women who have come for antenatal care. They have been tested, first test, and they have a negative HIV result. There's something that I want to explain briefly about a negative result. If you come to antenatal care for the first time and you are tested, and before coming for antenatal care you didn't know your HIV status, it's important to remember that we will retest you after some time. We'll retest you after some time because the kind of tests that we do are called rapid tests. Rapid tests, we check for antibodies that fight HIV in your system. That means that when you get infected, your body develops antibodies that fight HIV. So before your body develops these antibodies, you will not get a positive result. So what am I talking about? It is called window period. Window period is the period between the time of infection and the time someone gets a positive result. For HIV virus, it takes 3 months for someone to get a positive result, for your body to develop antibodies that fights the virus. So that means that if you are in a relationship, you had an intercourse with your partner 2 months ago, and you've developed morning sickness, which is not very comfortable, I know. So you are forced to come to the hospital to check what is going on. Then we do for you a pregnancy test and you are positive. When we do for you a HIV test, we will tell you that we'll have to do a repeat test after 3 months, because remember that you had an intercourse 2 months ago. Your body has not yet developed antibodies. So that means in the new booklet that we are currently having in Kenya, this one, yes, we have indicated when mothers are tested. So the first test, when you come for antenatal clinic, on first contact, we will give you a test. Before we discharge you to go and deliver, on your last visit, we will do for you a repeat test. When you go to deliver, in that delivery room, you'll be retested. Remember that you'll be retested irrespective of when you are tested last. Maybe we discharged you 2 weeks ago, then you go to deliver. Then a nurse tells you that, okay, we want to do for you a HIV test. Don't start telling the nurse that, oh, I just did it 2 weeks ago. No, it is a policy. We repeat HIV test, though it's not a must. You have a right to opt in or out of the test. Then when after delivery, 6 weeks after delivery, when you bring your baby for immunization, we will retest you. Yeah, so don't say again that I was just tested when I went to deliver. It's a policy again. It's indicated in the book. If you have this book, you'll be able to see for yourself. We'll give it to you. Then we repeat HIV test after every 6 months until complete cessation of breastfeeding. Yes. So again, let's come back to the starting point. Right now we are advising ladies to come with their partners, so that their partners also get tested. So many people like saying that, oh, this is my partner, so if I'm negative, it means he's also negative. No, that's not true. Remember, in my previous video, I just discussed about discordant couples. Partners who are in a relationship but they have different HIV status. One is positive, one is negative. Let me say something little about certain types of individuals. There are some people, okay, human beings have cells, and these cells have entry points. These entry points enable the virus to get into your cells and into your system. and they change the nature of your cell. Your body develops antibodies. Then after 3 months, as I said before, when we test, we are able to get the antibody and we say that you're HIV positive. So I've said that these cells have entry points. Some people were created in a way that they don't have these entry points. Yeah, amazing, isn't it? Some people do not have these entry points, so they will never test positive. Yeah, so that's why we want you to bring your partner for testing. You can test negative, and we do not know if you are one of these people whose cells do not have entry points. Yeah, that's that. Sometimes also, some men like saying that you just go and tell the nurse that I have tested myself elsewhere and my result is negative, so she should just indicate it on the booklet. We don't do that. Why? We want to test your partner. Because right now what we are doing triple elimination. I said elimination of mother to child HIV infection, but we are not eliminating HIV only. We are eliminating HIV, we are eliminating syphilis, we are also eliminating hepatitis B. So when your partner comes, we'll do for him a dual test. It is one test kit that tests both syphilis and HIV. Yes. So that if he has syphilis, we treat. It's very important that you are treated for these infections. This book has ANC profile. Profile are the tests that are necessary for a mother to be done for, so that we know the baseline of your health, where we are starting from. If there are issues, maybe low blood in your low hemoglobin levels, we will give you hematinics to boost. If there are infections, we treat. Okay. Ladies can test negative, but they are in a polygamous marriage. So if your partner and you are faithful to each other, remember that you have a co-wife whom you may not be so sure if she is playing safe. Yeah. Then we also have some partners who, I don't know if they fear or they're not just cooperative. They don't want to come for HIV test. So remember that you are a lady who has come for clinic. You have tested negative, but you love your baby. The economy is so crazy. You don't want to spend your money taking your baby to the hospital all the time because your baby is immunocompromised. Your baby has gotten an infection. So you want to get a baby who is healthy so that you can use the little money that you have to live a normal life, not spending every month admitted at the hospital. Okay, so in a case where your partner is not cooperative, and in a case where you do not trust your partner, maybe you've had doubts whether he is faithful or not, we will put you on pre-exposure prophylaxis. It is a one-day pill. You take it every day. It protects you until the risk is low. When the risk is low, means that your partner has accepted, he has been tested, or you are no longer engaging in sexual activities. Okay, why have we introduced so many tests like I said before? We realized that mothers would come for first antenatal care, they test negative. Then 2, 3, 4 months after delivery, the baby starts having stunted growth. The baby starts developing infections all the time. When we do further investigations, we find that the baby is infected with HIV. And when we do for mother a HIV test, the mother is positive. So the question is, what happens along the way? Remember that at some point, for ladies who are pregnant, some of them stop engaging in sexual intercourse. But what about your partner? He could be quiet, or he would be playing safe, like he understands that you do not need to engage with him in intercourse, but he could be doing it elsewhere, so that makes him get infected. Down the line, some few months after delivery, when you resume intercourse, you get infected. This is the reason why we are emphasizing that we want to make sure that even mothers who test negative, we keep on retesting them after delivery. Because right now, as a nation, we are trying to eliminate maneno ya HIV. We want to do away with HIV. That is the last mile, the agenda that we are dealing with right now. We have been doing prevention of mother to child HIV transmission, but right now we are dealing with elimination. We are trying to do away with it. So we want to make sure that a negative mother remains negative. We do for her follow-up until complete cessation of breastfeeding, so that the baby ends up being negative. It's important to remember that all these things that I'm talking about, they are not a must. We will counsel you, we will tell you the reason why these tests are important to you. It is your decision to make. I don't think that there is any lady who would wish to find out that she's positive when it's already late. In my previous video, I said that with HIV infection, the faster you are managed, the best. So that is the way we do things. For ladies who test negative, we encourage them to remain negative by applying ABCD. ABCD, that is A, if you conceive and you are not in a serious relationship, you are supposed to abstain from sexual intercourse. Yeah, if you can't abstain, which is A, you can be faithful to one partner. Yeah, but there are some people who can't be faithful too. If you can't be faithful, we go to C. Then use a condom. Okay, now you are in a serious relationship, or maybe you're married, but there is no trust and you have to keep on having intercourse with your partner. Use drugs, which is pre-exposure prophylaxis. Okay, we also tell ladies to encourage their men to get circumcised. Research has shown that men who are circumcised have hardened glands. A hardened gland is not prone to trauma. It is trauma that causes bruises. A bruise is an entry point for the virus. So men who are circumcised, they hardly get infected through unprotected intercourse compared to men who are not circumcised. Again, for ladies who come for clinic and they test negative, we also screen them for gender-based violence. You can test negative, but your intimate partner is not very good to you. Sometimes he beats you up. Sometimes he forces himself on you. That is a lady that can easily get infected. So we screen, and if you find that you are undergoing any form of gender-based violence, we link you. Yeah, so that is all for ladies who are HIV negative. Please, if you have a comment or any question, leave it in the comment section. I will handle it. Thank you for watching. In my next video, I will handle delivery. A mother who has conceived, who is HIV positive, and now is planning to go for delivery. What are the factors to consider? Which are the best modes of delivery for these ladies? Like, share, subscribe, so that when the next video is posted, you are notified. Goodbye.